shortly.
Okay, it is Wednesday, and that means it's time for Morning Rounds. Dr. Rocco joins us this morning to talk about breast cancer awareness. Thank you for joining us.
Thank you for having me.
And good morning. And can you tell us a little bit about breast cancer?
Yes, so breast cancer is abnormal cells that begin either in the milk ducts, which is the most common place. About 80% of the cancer we see starts in the milk duct and is called ductal carcinoma, or in the lobules, which is called lobular carcinoma. And most of the treatment is either a lumpectomy or a mastectomy. Fortunately, we do less mastectomies now, which is great for women. And if they do need a mastectomy, the good news is most women can have reconstruction at the same time that they do mastectomies. We're very lucky to have a plastic surgeon that can do that reconstruction now.
How many people are diagnosed with breast cancer, and are those numbers increasing?
No, the incidence about the same. I think women feel that the incidence is increasing, but I think we do a better job of discovering it with mammography.
Yeah.
So there's going to be about 193,000 cases this year of breast cancer in women across the United States, and about 1% or about 1,900 of those will be in men.
Oh, wow. And so what should women expect when they go to get a breast cancer screening? And how old should you be before you start getting those screenings done?
Screening mammograms should begin at age 40 unless there are family history. And the rule I use for that is you should have your first screening mammogram 10 years before the earliest person was diagnosed. So for instance, if your mother was diagnosed at 45, you should start at 35. But otherwise, screening mammograms, which means you're having no symptoms, should start at 40.
There's some confusion about when women should get a mammogram. How do you stand on that?
Right. So a couple of years ago, the task force came out and said that women don't need to start till 50 and we should do it every other year. Most of us in the cancer community feel very strongly that mammography is a very good tool to detect early breast cancer. And I not only think that we should detect it early because we have a better chance of treating it, but obviously if we detect it earlier, treatments are better in that we can offer less invasive treatments, and sometimes patients don't need chemotherapy, and that's also something to consider.
And tell us a little bit about the relationship between Marian Medical Center and Johnson's and UCLA, and how they kind of benefit there.
Yes, so we're very proud that we are affiliated with the UCLA Cancer Center. So our patients benefit from all the clinical trials that are offered through UCLA can also be offered to our patients here in Santa Maria. And that's probably the most exciting part about cancer treatment right now. Patients that are diagnosed with breast cancer and come to our facility have the cutting-edge treatment that they may not otherwise be able to receive because of that affiliation. And clinical trials are drugs that are being looked at that might be better than what the standard drug is. So we're very excited, and we've been participating in that for many years, and that's where discoveries are made, and that's where we change the standard of care, and patients may beat that cancer that we're trying to beat. So it's very exciting.
Quickly, do you think the message is getting out about breast cancer awareness?
Absolutely. Yeah. I mean, you could see all of the month of October everywhere was pink, and it's exciting for me to see how people want to participate in that and make the awareness so obvious, and it's a very exciting time.
Excellent. Well, if you have a question about your health, send it to morningrounds@kcoy.com. Thank you, Dr. Rocco.
Thank you for having me.
We'll be right back.